Assalamu alaikum. My name is Maryam, third stage in Muslim Medical College. Me and my friend will present to you our seminar about Achalasia, supervised by Dr. Elaf Abdulwahhab. Contents of this seminar: definition, epidemiology, causes, pathophysiology, types of achalasia, morphology, symptoms, diagnosis, treatment, and finally conclusion. What's achalasia? Achalasia is condition that affect the lower esophageal sphincter. The sphincter is a muscle that controls the passage of food between the esophagus and the stomach. In achalasia, the lower esophageal sphincter doesn't completely relax and the passage of food is compromised. Epidemiology. Achalasia is a rare condition that affects around 3,000 people in the United States per year. Most patients are diagnosed between the ages of 25 and 60 years old. Men and women are affected with equal frequency. The disease can occur at any age, but onset before adolescence is rare. Now, I talk about causes of achalasia. The cause of achalasia is unknown. Theories on causation invoke infection, hereditary, or an abnormality of the immune system that causes the body itself damage the esophagus, autoimmune disease. The esophagus contains both muscles and nerves. Some attribute the lack of muscle relaxation in the lower esophageal sphincter to a neurological problem. Others have considered a genetic component. Pathophysiology. Achalasia is best defined a primary motility disorder and the only one with an established pathology. Lower esophageal sphincter pressure and relaxation are regulated by excitatory, for example, acetylcholine substance P, and inhibitory, for example, nitric oxide, vasoactive intestinal peptide, neurotransmitters. Persons with achalasia lack non-adrenergic, non-cholinergic, inhibitory ganglion cells, causing an imbalance in excitatory and inhibitory neurotransmissions. The result is hypertensive, non-relaxed esophageal sphincter. The predominant neuropathologic process of achalasia involves loss of ganglion cells from the wall of esophagus, starting at the lower esophageal sphincter and developing proximally. In the peristaltic esophageal body, achalasia is characterized by loss of intrinsic acetylcholine containing nerves. Now, types of achalasia. We have three types of achalasia. Type 1, classic, with minimal contractility in the esophageal body. Type 2, with intermittent periods of pan-esophageal pressurization. Type 3, spastic, with premature or spastic distal esophageal contractions. Morphology. In achalasia with endoscope we seen narrow lower esophageal sphincter, dilation of esophagus, and thickening of mucosa. The histopathology of achalasia involve inflammatory cell infiltration, dilated intercellular spaces, muscular semimucosal atrophy, and epithelial wave were only observed in achalasia. Fibrosis between circular and longitudinal muscles, and reduction in myotonic ganglia and myotonic neurons. This is the epithelial waves. Now, my friend Yamamah will continue.
I am Yamamah, and I will continue about the symptom of achalasia: chest pain, weight loss, and cough. Heartburn, regurgitation of foods, and dysphagia. The diagnosis of achalasia: barium swallow, bird's beak appearance of the lower esophagus, dilatation of the esophagus and stasis of barium in the esophagus. Esophageal manometry or an esophageal motility study. During the test, an electrode is placed in the esophagus and the patient is given something to swallow. After 10 swallows, the electricity generated by the esophagus is measured. The finding: incomplete lower esophageal sphincter relaxation in response to swallowing, high resting lower esophageal sphincter pressure, and absent esophageal peristalsis. Esophagogastroduodenoscopy. Patient with esophageal cancer, esophageal stricture from chronic reflux or upper stomach cancer can have a similar presentation to achalasia. This is called pseudoachalasia or secondary achalasia. So, making a distinction is very important. The treatment of achalasia: balloon dilation, Botox, hilar myotomy, and peroral endoscopic myotomy. Finally, the conclusion: achalasia is an uncommon disorder of the esophagus that your physician may treat with a combination of medication, balloon dilatation, surgery, and nutrition. If you are experiencing the symptom of achalasia, consult your physician. Thank you for listening and hope you like it.